Turning to news now from our community, I am joined today by a couple special guests, Abhi Harikumar and Sam Phillips. Thank you so much for joining me.
Thanks for having us.
I feel like I'm so far away over here. All right, the Executive Director and Chief Operating Officer of a local healthcare nonprofit. It's called Project Embrace. All right, so let us know, what is this all about?
Yeah, absolutely. So Project Embrace is a healthcare nonprofit. We essentially serve patients within the Greater Mountain West as well as abroad. And we provide them with access to necessary medical resources. We do this by basically collecting equipment from community members as well as other donations. We clean it, we sanitize it, we redistribute it to communities and individuals who have difficulty accessing this healthcare equipment otherwise. We've worked with unsheltered communities, indigenous populations, refugees, basically anyone that needs access to healthcare. We try to find some way to help them out. We worked with patients from Zimbabwe all the way to right here in Salt Lake City.
And
interesting. With the help of our Salt Lake City community, you know, we've been able to play a critical role in being the first response to the COVID-19 pandemic when a lot of other communities and a lot of other nonprofits were struggling to get people the help that they need to do so.
It's pretty cool. I don't mean to interrupt you, Sam.
Yeah.
How did you get involved? What's your passion behind this?
Yeah, so our just kind of ethos here, our main, the core of what we do is really just making sure that everyone has the access to the healthcare system that they deserve. You know, COVID, it has been an unprecedented last 2 years. Outside of just the tragedies from our friends, our family, our neighbors, we see it interfering with all sorts of processes across the world, whether it's the global supply chain or being able to get the right healthcare service when you're at your local hospital or clinic. And so we really kind of took it upon ourselves to make sure we could kind of fill the gap as best as we can between the global supply chain and some of our communities in rural Utah that otherwise had really a difficult time accessing and participating in that global trade of medical equipment.
So if somebody wants to get involved, how do they do that? Maybe to donate, or maybe they need some help?
No, primarily that would be the best way of getting involved. You can actually go visit projectembrace.org/donate. What we really need right now is we're going to be going out to a lot of the communities that we've been to in the past, and you know, we never want to have to turn away someone based on the cost of basic healthcare equipment, and we need people's help to make sure that we're able to meet our transportation and our operation costs. So if you go to projectembrace.org/donate, you're able to donate funding, or you can go ahead and donate medical equipment. It's laying around your house, like you got a wheelchair, maybe a four-wheeled walker that's collecting dust, no one's using it. We can make sure that it gets to someone that it could really, really help.
That's a great idea because, you know, a lot of people do need something. It's expensive. They get it. And they only have it for a short period of time, or maybe it's for somebody, but for not a very long period of time.
Right. Well, and these things aren't built to be used once and then thrown away. They're really built to last.
Right.
And so, you know, we're trying to do our part to kind of continue the lifespan of these devices and at the same time provide this necessary service to folks who otherwise may not be able to afford it.
I know that my son needed a pair of crutches recently. Just he'd hurt his knee and he couldn't put any weight on it, and suddenly we had to hurry and find some crutches, right?
Yeah. Right.
And luckily we had a friend who had some, so that's kind of a way to take it on a larger scale with what you're doing.
And a lot of the vendors that we sometimes work with, we notice, you know, they don't necessarily have the resources or the infrastructure to get this equipment out to people that need it, and so a lot of times it just ends up going to the landfill.
Wow.
We're just throwing away hundreds of thousands of dollars worth of this equipment that really could be going towards someone in need.
Now I understand you've been going to some of the Native American areas and some of the reservations here in our area. Do you have a trip like that coming up as well?
Yes, we do. We're actually going to be going back out around the winter time towards like late January, early February. We've been working very extensively with the Navajo tribe around the Four Corners region, as well as surrounding indigenous groups around the area. And so we're planning to go back out there working with the same community partners that we did last time, as well as a few new ones. And throughout the time that we're doing this, we're trying to collect as detailed of a picture as possible of what this community's healthcare needs are and how they've been maybe changing throughout the course of the pandemic and maybe even after.
How do you get your funding? I know a lot of this stuff is expensive. You get a lot of donations,
Yes.
As far as medical equipment, but are you getting funding as well to help?
Yeah, so we do apply to grants, and grant funding is a portion of how we cover our basic operations costs to be able to do a lot of this. But we also rely on the Salt Lake community and our greater kind of Project Embrace friends.
Okay, all right. So that's why they're putting out the call here as well. If somebody is interested in donating, one more time, the best way to get a hold of you guys.
Best way to do that is to go ahead and go to projectembrace.org/donate. You can go ahead and donate funding as well as equipment there. Whatever you're able to donate. You know, we've been doing this for a couple of years now, about 5 years. We've been going strong. And every single time we go out there, every single time we do it, we've been able to get better and better at it. So each dollar that you donate to us, we've been able to maximize the social impact of how far that dollar goes.
I love it.
As you can see on the slide right there, it costs an average of about $8 for us to donate any piece of medical equipment, whether that be as simple as a cane or as complicated as an electric chair. So we're able to make that dollar really, really go to work.
I love it. All right, Avi and Sam, it's so nice to meet you. Project Embrace, we all know a little bit more about it now. It's pretty remarkable. We'll be watching and following what you guys do. Thank you.
Thank you so much.
Yeah.